One of the things that we are really preaching here at the office is called directed water irrigation. It's cleaning in between your teeth using water. I'm not against dental floss. I'm not against these little brushes. I got some right here. You can buy these brushes to go in between your teeth. I'm a big fan of whatever works. So whatever method you're using for cleaning your teeth, one of the things you have to do is check yourself at the end, and you're going to be getting some of these today too. These are called disclosing tablets. They stain the bacteria on your teeth. So clean your teeth as good as you can. Chew up one of these things, rinse your mouth out, look in the bathroom mirror, wherever there's stain on their teeth, that's where you still have bacteria. How can we get all that off? Well, I'm a big fan of electric toothbrushes. You can use a manual, it just takes longer. When you're using an electric toothbrush, use it like when you take your car through a car wash. You know how those rollers go really slow by the side of your car? That's how you use an electric toothbrush. Let it do the job. Just move it nice and slow. Personally, I do 2 minutes on the top teeth, 2 minutes on the bottom teeth. You can do whatever you want to do, but I want to make sure I got the bacteria off my teeth. So I'll do, a lot of these electric toothbrushes have a timer, a little beeper that goes off every 30 seconds. So I do 1 minute on my upper left, 1 minute on my upper right, 1 minute on my lower right, and another minute on my lower left. So it takes a little longer, but I'm being more thorough. When it comes to cleaning in between the teeth, again, you have 3 different options. You can use dental floss. Most people don't really floss. Most people pop. Popping is when you take the floss in between the teeth, you wiggle around a little bit, you take it out, you go to the next one, you wiggle around, take it out. That's called popping. Flossing is when you go in between the teeth, you wrap the floss 180 degrees around one of those 2 teeth. You slide the floss up and down 5 or 6 times, then you wrap it around the other tooth. You slide it up and down 5 or 6 times, then you take it out, you go to the next space. Most people don't take the time to do that. Again, I'm not hung up on technique, I'm hung up on results. So whatever you're doing, do whatever you're gonna do, and then check yourself with disclosing tablets. And you can find out how good a job you did, or if you did an other than good job. I'm a big fan of directed water irrigation. Now you can use a Waterpik, which, here's a Waterpik. You can see how that works right there. Or you can use one called a shower breeze. This hooks up in your shower. I'll show you how to hook, in fact, it's easy to hook up. I'll unhook it to show you just how you hook it up. If you can unscrew a light bulb, you can do this. So there's your shower head, something like that, right? Even if you have a hose that comes off like that, this is the shower head. Unscrew this. This is the device. It's really simple. Screw this on your plumbing up there. Put your shower head back on. There's a little adhesive holder that keeps this tip on the shower wall, hang it up behind you, and you're all set. When the lever's like this, all the oil comes out your shower head. Go ahead and take a shower. Personally, I wash my body, wash my hair, I shave in the shower too, and then when I'm finished with that, I use my electric toothbrush in the shower. 2 minutes on the top, 2 minutes on the bottom. And it's nice if you have the water run on your back, the time goes by a little faster, it's kind of nice. When you're using the directed water irrigation, just flip the water down here. And again, if you use the Waterpik, you can use the same thing. I'll give you some ideas on that. But here's how you use it. And I want you to see the way you're using this. This is the tip, whether it's your Waterpik, whether the shower breeze, whatever you're using. What you want, remember, you just brushed here, here, and on the chewing surface, but you didn't get in between the teeth. The way you use it is aim this directly in between the teeth, and you let it shoot the gap for 5 full seconds. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. It's a lot longer than you think. But the reason this works is something called the Venturi effect. Whenever you have a flowing fluid, it creates a negative pressure, a suction right next to it. What that means is when you shoot the water in between the teeth and you let it sit there for at least 5 seconds, you create a suction under the gums and you suck out the toxins, the bacteria that are down deep under the gums. When you use the toothbrush and dental floss, you get 1 to 2 millimeters under the gums. That's it. When using directed water irrigation, they say you can get 4 to 5. Some people even think 6 millimeters under the gum. You can clean if you leave it in there long enough. Now remember, you're not aiming it into the gum, you're aiming it over the top of the gum, to where if the water came out, it's going to hit my finger right here. Not down here, but right there, so it goes over the top of the gum. Start the very back of the last tooth. 5 seconds there. 5 seconds there, all the way around, top and bottom. You don't have to go this direction, just one direction. And then when you're all finished, what I like to do is just flip the lever back here, hang this thing up, and I'm done. So, but you still have to check yourself to make sure you did a really good job. If you're using a Waterpik, which is great, Use as warm of water as you can comfortably tolerate. Don't burn yourself, but warm, warm water. Put it all the way on high. 2 hints on the Waterpik. Number 1, make sure it's in your mouth before you push the button to turn it on. You usually only make that mistake one time. Goes everywhere on that. The second thing is do not look in the mirror. Look in the bottom of the sink. If you look in the mirror, you're gonna make a mess everywhere. But if you look in the bottom of the sink, there's 2 things that are really great. Number 1, you're not gonna make a mess. But number 2, you can see the stuff coming out of your mouth that's big enough for you to see. We're talking about food particles, hunks of meat, hunks of whatever. And you'll say, I just brushed, I just rinsed my mouth out. Where'd that come from? That's the point. When you see this coming out, this is the stuff that's big enough for you to see. It's like, oh my gosh, I left that behind? Yes, but you can't even see the bacteria that's coming out. So again, 5 seconds directly in between your teeth. 1 Mississippi, start the back of the last tooth, all the way around, top and bottom. You just have to go one direction. You may have to fill up this tank a couple of times to your whole mouth. That's okay. But if we're willing to spend that 5 to 10 minutes one time a day doing a thorough job, oh my gosh, the dental needs are going to go way down, plus the health that's going to go way up. So here's a couple of ideas of cleaning in between your teeth. I'm not a big fan of flossing because most people don't do it right. I'm never going to tell you don't floss. But if you do floss, floss first and then use the water irrigation later, because the flossing loosened up a bunch of bacteria, food, whatever it was. Now we have to flush it out and get it all cleaned out. So anyway, this is in the interest of your better dental health, which is going to affect your medical health. So hopefully we gave you some ideas right there. So ask us. We've got all this right here at the office just for you. So thank you so much.